Hey guys, it's I don't know how I'm gonna reference you, but anyway, I am getting double jaw surgery today. I have very mixed feelings about it. I'm excited, I have anxiety about it. I started this entire process almost 2.5 years ago. Almost 3 already, I guess. About 2.5 years for sure. It all started when I was really investigating the process of getting braces. I had never had braces before as a kid, and I finally felt that it was time to get some. My teeth actually weren't very well placed. They were kind of all over the place, but with my orthodontist, Dr. Haven, he's done a really great job of getting everything aligned and getting everything situated. So my teeth actually look really good from a front profile. If you look from the front, it doesn't look too bad. But you're gonna notice that I have an underbite down here where, if you take a look, take it closer, you'll see that my upper teeth sit further back than they do forward. Now I know there are other individuals out there that have their jaw issue much worse than I do, but mine, when initially started, was actually pretty bad. But the correction in the bite and the teeth have actually helped a lot in the overall appearance of that. So you might notice, as far as like the front view, it doesn't look as bad, but really for me, it hasn't really bothered me so much because I've gotten so used to it over time. But it's always bothered me that I couldn't be able to smile properly, and have obviously a slight overbite instead of an underbite in that case. So what I'm going to do right now is going to go and show you the side profile of how my face looks. So, and what you're going to notice on the side profile is that my lower jaw, this lower jaw definitely extends a lot more than I would like, and it doesn't have a very good facial impression. And also, I know most people probably won't even notice, but the alignment of my face is not perfectly square and aligned. It's a little bit at an angle, and I think my surgeon is going to go ahead and try and correct all of those little features on there. So as far as my double jaw surgery is concerned, they're going to push my lower jaw back just a little bit, a few millimeters, and move the front of my jaw forward. And so that's kind of the major surgery portion of it. My cheeks, from what I understand, are going to be more pronounced a little bit more after the surgery is done. And hopefully, I don't lose the jawline, which I like. But the problem is, again, the misalignment in my face right here, and also the jaw movement. Now you might be wondering why in the world I decided to go with the whole jaw surgery thing. It's just some issues. Again, it's just the appearance and being able to smile naturally, eating normally. Usually I'm only able to eat on one side of my mouth, and it's not very convenient. Also, I can actually pop my jaw around here just by opening my jaw, and that's rather discomforting. I also have kind of a slurred speech. I tend to spit a lot, and I think it has a lot to do with the fact of my underbite causing those particular problems for me. Other than that, I mean, because I started 2.5 years ago, I was very excited then. I was like, let's do this, let's go ahead and get this done. But as time went on, actually my feelings kind of subsided about it until today, and actually the last few weeks that the whole process rebooted. Up until then, it was just going to the orthodontist, getting my jaw and my braces done and my work done there. But now the surgery is actually coming around, and kind of that anxiety is kind of building up again. I'm not really sure how I feel about it. It's kind of mixed. But now I'm here, and this is the point of no return. It's gonna happen. And the next time I see you in this video, it's going to be after the surgery. You're gonna see my cheeks all puffed up, and I will definitely try and make a video every day, or just take photos every day, kind of showing you the progress of how my teeth actually look, or rather my face looks, and the structure. I know it's going to take about 3 weeks until they take the bands. I noticed that in other videos that a lot of individuals have their teeth wired shut. Mine are actually going to be banded shut. And then it's going to be roughly 3 weeks or so until they remove those bands, and it won't be until 6 weeks until I'll be able to start doing any type of normal activity. But for the most part, you know, the thing that I'm kind of a little concerned about is maybe the food, what I'm going to be eating, how that's going to go down, knowing that it's going to be completely liquid diet for a few weeks, if not a little bit longer. So that's kind of my concern. And also, right after the surgery, I've seen plenty of videos already where, you know, patients are coughing up blood, and so seeing that isn't necessarily the most enjoyable thing in the world, and having to be ready for that is going to be kind of challenging. So I just know for a fact that the first week is going to be the toughest week. I'm going to be bumming around just watching Netflix or playing video games for that week until things get better. But again, like I said, the next time you see me in this video is going to be after the surgery, and hopefully I can keep you updated and posted throughout the entire process. Other than that, hopefully everything goes well, and I will catch you guys later. Bye.